celiac disease or are following a gluten-free diet because you found that it improves your overall health. And I feel like many of you who are out there kind of going it alone are still struggling and in a sense missing the mark nutritionally and don't know why you're missing the mark. So when I thought of like the most important thing, if I could teach you one thing that would, just elevate your nutritional status and elevate your health to new heights, this is kind of what I came to the conclusion of. So I'm going to dive into this show tonight. I want you to stay with me to the very end because I'm going to give you some actionable steps that are going to allow you to go and visit, with a doctor, with your doctor, and ask them what kind of lab tests to run. You'll understand why I'm talking about lab tests here shortly. But I really think it's important that you follow along with me and that you understand this information, especially those of you who've ever been diagnosed with celiac disease or are following a gluten-free diet or are non-celiac gluten sensitive or have silent celiac disease or any of the other known synonyms that you want to give, that terminology. So before we get started, say hello. Tell me where you're tuning in from. Chime in. Don't be a stranger. And as always, I'm going to answer questions at the end. So first come, first serve. Make sure that you pump those questions into the feed, and I'll do my best to get your question answered, provided it is somewhat relative to the topic that we're talking about tonight. So let's dive in. The number one thing that you can understand or that you should understand, and so we'll start off with a couple research studies to kind of set the stage for what I want you to know. And so this first one was just published not very long ago, actually, published out of the Mayo Clinic Proceedings. It was published in June. And what they did is they did a study on 309 different people, men and women, and they were testing them. These were people with a diagnosis of celiac disease, and what they were looking for were nutritional deficiencies. This is one of few studies that has ever been done. There are some more, but that have ever been done on people with celiac disease or gluten sensitivity and actually analyzing their nutritional status. Now, I've been doing this for 20 years in practice in thousands and thousands of people, and I'll share some of my insights with you tonight as well, but I want to share the insights of what some of these researchers have recently published. 309 patients, they found that almost 20%, 19.7 of them were low in albumin, which is protein. Now, albumin in the blood is one way we measure protein, and protein, of course, is super critical for immune proteins. You need protein to build antibodies. You need protein as well to heal and repair damaged tissue. So this is a pretty important finding. 20%, that's one in 5 people, right? They also found that copper was low in 6.4% of people, not quite as many, but still an important finding because copper is necessary to form new collagen and to heal and repair tissue as well. They found that B12 was low in 5.3% of the individuals that they studied. They found that folate was low in 3.6%, and they found that vitamin D levels were low in almost 20%, 19%. So again, well, not completely done here. Ferritin, which is not exactly iron, but this is stored iron in the liver. So it's not the best marker for iron status, but it is one of the markers for iron status. And so they found that iron storage was low in almost 31% of the patients that were studied. So again, we've got, in this particular example, protein, folate, copper, vitamin B12, and iron, right? So 5 critical nutrients that your body needs to heal and repair. So think about this from the perspective of having gluten sensitivity or celiac disease. If you are gluten sensitive or celiac, you're not playing with a full deck of cards. You are in a state of disrepair, right? When you start this process, where generally speaking, people don't just assume that they're gluten sensitive and go on a gluten-free diet. They're sick. They go through rounds of different doctors. They go to different specialists. They're trying to find an answer. And if they're really lucky, they'll find a doctor smart enough, in many cases, to identify that food is actually the culprit. And so by this time, their bodies are in very, very much a big state of disrepair. So there's what we would call a repair deficit. Their body has broken down to such a great degree that lots of things have gone wrong. Now, hold on to that thought process because we're going to talk more about it in just a minute. So again, these people aren't playing with a full deck of health. They're playing under the status of a disadvantage because they're already in ill repair. Now, I want to pull up another research study, and yeah, let's put it right here and show you. So again, this is a recent study. It was a relatively small study, only done on a few hundred patients. But this study, a little bit more robust, here's what they found in this particular research. And this was published in 2013 in the journal Nutrients. What they found is that 87.5% of patients diagnosed were deficient in at least one nutrient. So 87% deficient in one nutrient. Now, it only takes one nutrient to cause disease. One nutrient deficiency, for example, vitamin C deficiency can cause scurvy. Vitamin B1 deficiency can cause beriberi. Vitamin B3 deficiency can cause pellagra. It only takes one nutrient to create health problems and create disease. So it's important, don't underestimate this. And this is 87.5%, right? And then you can see here, 53.8% of patients diagnosed were deficient in at least two nutrients. So almost 90% one nutrient, two nutrients, 53.8%. Okay, and we look even more at certain specific statistics here. 7.5% of them were vitamin A deficient, 14.5% were vitamin B6 deficient, 20% were deficient in folate, which is vitamin B9, 19% were deficient in B12. Now, this is a very different number than what we saw in this other study. And so the reason why I point that out is because if you look in this other study, again, B12 was found to be deficient in 5.3%. And then folate was found to be deficient in 3.6%. So a lot higher numbers in this particular study, and that's what we'll see across the board in a lot of this research. So 19% deficient in B12, 67% of the patients were deficient in zinc. You don't even see zinc being mentioned in this research study. And that's another problem with a lot of the research studies that are published, is that one, it's the mechanism by which they're measuring deficiency. So remember, you've heard me talk, if you've listened to me for any length of time, you've heard me talk about why serum nutritional values are poor indicators for long-term nutritional status. And so this is one of the reasons why some studies show higher quantities and some studies show lower quantities. It has in a sense to do with the methodology of how the tests that they're using. Again, stay with me tonight. I told you at the very end of the show tonight, I would give you a list of tests that are accurate that you can ask your doctor to order to assess your nutritional status. These are ones that won't give you a lot of false lows and highs and misreadings. So again, 67% deficient in zinc. 46% of patients had iron storage deficit, so almost half. And then 32% of the patients had anemia. Now look at the disparity between these two. So a lot of people think of iron deficiency as anemia, but they're not the same thing. You can be iron deficient anemic, but not all people with anemia are anemic because they have iron deficiency. Iron is one cause of anemia, iron deficiency. Vitamin B12 deficiency can cause anemia. Folate deficiency can cause anemia. Vitamin B6 deficiency can cause anemia. Copper deficiency can cause anemia. So there are a number of different things that can cause anemia. My point is 32% of the patients out of this research study were anemic, but 46% had iron problems, meaning that you can have an iron deficiency and it might not show up as anemia yet. And that's important to understand because a lot of doctors use an iron test to measure iron, but most doctors use a blood count test to measure anemia. So what happens a lot of times, you go to the doctor, they do a blood count, your blood count's normal, they say, oh, you're healthy as a horse, you're fine, you don't have anemia, but it doesn't mean you don't have iron deficiency, and that's important. Again, I'll give you a list of tests to ask for when we wrap it up tonight. So contrary to popular belief, 29% of the diagnosed patients were not underweight at the time of diagnosis. So this is another thing about celiac disease, is that it's oftentimes thought that people that get a celiac diagnosis have to be skinny and thin and have a hard time keeping weight on and malnourished. Well, you can see here, according to this research study, 29% of those diagnosed were not underweight. They were actually obese. So you can have a gluten issue and be overweight or obese and not be underweight. And this is another kind of misconception, especially amongst GI doctors, at least in my experience. See a lot of GI doctors say, oh, you're not underweight, you don't have a gluten issue. If you go gluten-free, you're going to create malnutrition. Like, that's their mindset, and it's wrong, and we know it's wrong. So again, these are just two recent studies that illustrate a point that I wanted to make tonight, which is nutritional deficiency is very, very common in people with gluten issues. Now, so kind of hang on to that thought. Nutritional deficiency is common in people that have gluten sensitivity issues. Now, let's blow this one up for you a little bit. This is another research study just published in February, actually, of this year. Okay, you can see it's a review of studies. So I like reviews. I like reading research reviews because generally what happens, these doctors pull together hundreds of different research studies, in some cases thousands, and they look at all of the data, they pull it all together, and then they make sense of it. And then they draw some different inferences and conclusions. But in this review, so again, this is a study of studies. You can see the title is Nutrient Deficiencies in Adults and Children with Treated and Untreated Celiac Disease. Okay, and so what they found in this study was whether the person was just being diagnosed with celiac disease. That's untreated, right? Untreated means you haven't gone on a gluten-free diet yet. They found wide-scale nutritional deficiencies in untreated celiac and gluten-sensitive individuals, but they also found widespread nutritional deficiencies in people who had gone on gluten-free diets. Now, if you've read No Grain, No Pain, you probably already know what I'm about to say, which is most people, when they go on a gluten-free diet, they do it wrong. They eat all the junk food and all the processed food. They eat all the food that has zero nutritional value, and so they never correct nutritional deficiencies, and they just end up kind of collecting them because they're eating poorly. This study found that to be the case. They found that people, whether they were treated or whether they were on a gluten-free diet or not on a gluten-free diet, they had a lot of nutritional deficiencies. And the key thing, and the reason why I feel like this is the number one important thing I could teach you, is because when you're coming into a gluten-free diet, the likelihood that you have nutritional deficiency is extremely high. Now, when we take and we look at each individual nutrient, when I talk about a nutrient, what I'm referring to are what are called essential nutrients. What is essential nutrients? What are we referring to? What does that mean? Essential nutrients are what it infers, right? Essential means the body cannot sustain health and life and function without these nutrients. These are things like your vitamins, your minerals, your amino acids. They're essential, meaning you have to eat them. Your body cannot synthesize them. You have to eat them, right? So things like your vitamins, your B vitamins, your fat-soluble vitamins, vitamin C, things like magnesium and calcium and zinc and chromium and selenium and copper and vanadium, etc. So these are essential nutrients. And so when the body lacks essential nutrients, then functions start to break down. Wherever that nutrient is necessary to perform a function for your body, okay, as in the case, for example, of magnesium. Magnesium plays a role in converting carbohydrates into energy. Well, if you're magnesium deficient, your body becomes less efficient at being able to generate energy from the food that you eat. So you become what? Tired, fatigued, brain fog, energy deficit, all because of that one mineral deficiency. Now, what we're saying here again is that people that have gluten sensitivity issues, the vast majority of them have at least one deficiency, okay? And more than half of them have at least two deficiencies. Now, here's what this research study shows. These are some of the top nutritional deficiencies found in people with gluten sensitivity issues. Vitamin B12, iron, folate, zinc, vitamin D, calcium. My experience, I'll share that with you. Let's drop this down. I want to show you what my experience is. My experience is this. If we put it in order from greatest to least, number one is vitamin D. Okay. Number two, vitamin B12. Okay. Number three is iron deficiency. Number four is zinc. This is just, again, my experience in running thousands of these nutritional tests and thousands of people over the past 20 years. And then we really could put a number 5 in here, and that's, in my experience, is omega-3 fatty acids. These are 5 of the most common nutritional deficiencies that we see. Now, what these authors did is they discussed, within the confines of these deficiencies, they discussed the secondary diseases that can be caused or contributed to by these deficiencies. So, for example, zinc deficiency in an adult can cause anorexia. You need zinc to produce digestive enzymes. You need zinc to seal the gut. So zinc deficiency contributes to leaky gut, among other health issues. And children, it can lead to failure to grow or thrive. So if you're a parent, you've got kids at home, you suspect gluten sensitivity, they're not growing or they're under the curve, this is what we're referring to, right? If you've got children that aren't growing. Now, failure to thrive in babies is a much more serious situation, but failure to hit those growth curves, oftentimes that can be a zinc deficiency. And so what doctors oftentimes will do with kids is they'll put them on hormones, growth hormones, to help them meet that growth. They never look at zinc. I shouldn't say never. They very rarely look at zinc as a potential reason. If we look at vitamin B12 deficiency, again, super common. In my experience, the second most common deficiency found in gluten-sensitive individuals, neurological disease. Well, what does neurological disease mean? This is kind of a broad category or broad spectrum of different conditions. Neurological disease could be things like neuropathy, numbness or tingling in the hands or feet. It could be kind of a radiating pain. There's a type of neuropathy that commonly gets misdiagnosed called carpal tunnel syndrome, which is, again, another different type of neuropathy. There are other forms of neuropathy that don't manifest as physical manifestation symptoms. So not like numbness, tingling, or burning of the extremities, but neuropathy in the brain, which is, depression, which is inflammation of the brain. Schizophrenia is a disease that's been linked to gluten sensitivity, and we know B12 plays a role. Demyelinating diseases like multiple sclerosis, right, where people start to lose their ability, their strength, right, and their ability to control their muscles very well. These are neurological diseases, right? And vitamin B12 deficiency we know can cause that. There's also movement disorders that are neurological, like gluten-induced ataxia or vertigo, where you become really, really dizzy. That's neurological as well. So these are all some of the hallmark manifestations of how vitamin B12 deficiency can show up as a symptom. Now, it's important to understand that, because if gluten is causing the deficiency and you go on a gluten-free diet, okay, going on a gluten-free diet doesn't necessarily correct the vitamin B12 deficiency. Going on a gluten-free diet, depending on how you're following the diet, stops the damage, okay? It stops the potential for malabsorption and nutritional deficiency, but it doesn't correct the existing nutritional deficiencies. Just a change in diet is not always enough to correct that deficiency. So what happens to that person who goes on a gluten-free diet, right, but they're still struggling with nerve symptoms or neurological problems, and then they get frustrated because they're on that gluten-free diet and they think, oh, this gluten-free diet's not working, and then they quit the diet. But the diet's what caused the B12 deficiency, but the B12 deficiency is what caused the neurological problems. And so going on a gluten-free diet might not correct the neurological problems, but if the person doesn't know they have the B12 deficiency, then they never really get an answer. And this is my point. This is why this is so important, is because gluten induces nutritional deficiency. The nutritional deficiency can cause a plethora of different symptoms, syndromes, diseases that oftentimes get misdiagnosed, right? You go to a neurologist if you have a neurological disorder, and 99% of the time, depending on the neurologist that you visit, most of them aren't going to measure your nutrition. They're going to put you on some type of medicine that appeases the symptoms of the neuropathy, or some type of medicine that slows down the immune system's aggression if it's an autoimmune issue, but they're not going to assess or address the origin of the potential problem, which very much might be a nutritional issue. You can see a lot of examples here on this chart. Hyperparathyroidism is another one. Vitamin D and calcium deficiency can contribute to hyperparathyroidism. Neoplasia, what is that? Neoplasia means new growth. This is actually kind of pre-cancer, if you will. We know, for example, zinc and folate deficiency can reduce your body's ability to control cancer cells. And so this is why they're linked to neoplasia. Impaired sexual maturation. We know that zinc is necessary for children to develop secondary sexual characteristics. In other words, little boys turn into young men, little girls turn into young women, and zinc is what plays a major role in that. We know that folate and vitamin D and calcium play a role in bone growth, in bone healing, and bone structure. So osteoporosis, very common sequelae or side effect of a person who's been being damaged by gluten for years and years and years. And then over here on this other side, Again, anemia, I mentioned this earlier, but iron deficiency anemia, vitamin B12 deficiency anemia, folate deficiency causes anemia, zinc deficiency can cause anemia. So it's not just really even these two nutrients. And then there's this other scenario here, which is hyperhomocystinemia, which homocysteine is one of the lab tests. We'll talk about that in a minute. I've mentioned that before if you've paid attention on my show, that the chemical homocysteine is an independent risk factor for cancer, heart disease, diabetes, and bone loss, and also nerve damage. So we never want to see this chemical being elevated. And again, this chemical is elevated. It's very commonly elevated in people with gluten sensitivity. Why? Because the gluten caused nutritional deficiencies. The nutritional deficiencies caused the elevation in homocysteine. So again, we have to think about the target that we're trying to hit. If we're identifying gluten as a problem in the diet, and we remove the gluten, it doesn't mean that the nutritional deficiencies that the gluten caused are automatically, magically going to disappear. It means that you need to have it evaluated. You need to have your doctor, demand from your doctor a nutritional status evaluation, because at the end of the day, this is a scenario that you don't want to get into. Let's blow that up a little bit bigger here for you and put that in the middle. So the gluten-induced gut damage cycle, right? And so here's what we've got. We've got a person who gets gluten exposure, okay? And if they're gluten sensitive, whether they're celiac or non-celiac, right? Gluten causes gut damage. Gut damage leads to nutritional deficiencies. Nutritional deficiencies can cause new symptoms and new disease. That can lead to poor health, which when most people are struggling, what do? Well, they don't heal as well. They continue to struggle until their symptoms grow, right? And that leads to more doctor visits. And then more doctor's visits, generally, depending on the type of doctor, most people go to mainstream medical doctor. Mainstream medical doctors are trained to medicate your symptoms. They're not trained to identify why your symptoms exist. This is the fundamental problem. This is why in America and in most industrialized countries, but specifically in America, the healthcare is $1 trillion industry. It's the number one source of outgoing revenue that Americans spend. Yet we spend all that money, but what do we get for the expenditure? We have record cancer, record-breaking heart disease, record-breaking autoimmunity, record-breaking diabetes and obesity and bone loss, etc. So we have all this money that we spend on all these doctor's visits that lead to more medications that don't really solve the problem, right? And then, one of the things that you have to consider with more medication is that leads to what's called drug-induced nutritional deficiencies. So drugs don't come without a cost. When you take medicine to suppress your symptoms, many medicines actually cause nutritional deficiencies. But wait a second, we started out over here, didn't we, right? So the gluten was causing nutritional deficiencies that were leading to gut, or that were leading to symptoms and disease. Now we're taking medicine to treat the symptoms caused by nutritional deficiencies, and we're actually creating more nutritional deficiencies in the process of taking that medication. But that's not all. Many of the medications also lead to gut damage. A lot of your medicines actually cause gut damage. It's one of the side effects. I mean, perfect example, over-the-counter, ibuprofen, non-steroidal anti-inflammatories damage the gut. Steroids, which are a common treatment modality for people with autoimmune disease, damage the gut. Certain blood pressure medications damage the gut. So the antibiotics damage the gut. So a lot of the main, the top medicines that are dispensed to cover the symptoms end up creating the gut damage, but they also cause nutritional deficiency. Well, we also said that gut damage also causes nutritional deficiency, so we get wrapped up in this cycle, right? That's why this is such a vicious cycle. And what ends up happening to the patient is, they trust their doctor, so they take the medicine, right? But then the problems persist, and then the problems morph, change, grow, get worse. Now they're frustrated. Right now they're frustrated, they don't know what to do, but they know what they're currently doing isn't working. And so this cycle, you don't want to get stuck in this. And so what do we have to do? What do we need to do? This is why it's the number one important lesson I could teach you, is because if you are gluten sensitive, you should assume that happened, and you should assume that this has happened. And so the thing that you can do that will stop this cycle is you can analyze, right? You can analyze the what here, right? The nutritional deficiencies. It's different for different people. If anything I've learned in 20 years of practice is no two people are alike, even though they may have the exact same existing conditions. You know, two people with rheumatoid arthritis caused as a result of gluten exposure, gut damage, nutritional deficiencies, etc. You can analyze their nutritional deficiencies and they're never identically the same. Everybody's unique in that right. And that's why it's so important that you understand that this has to be analyzed, because if you've cut out the gluten, right, if you have cut out the gluten and done a good job of doing that, then you stop the gut damage. But again, that doesn't mean that the nutritional deficiencies that you currently have that are causing problems for you magically go away. You have to get that looked at. And in some cases, you know, once you understand this information, you've got a couple of options. The first option is you can eat foods that contain higher quantities of the nutrients that your body is lacking. So for example, if you are low in vitamin B12, then you can incorporate more animal-based protein that is rich in vitamin B12 to help get that deficiency corrected. You can also supplement. And, you know, many vegetarians, for example, want to supplement with B12 because they don't want to eat meat, and that's fine. But if you don't know what deficiencies that you have, then you're now not empowered to make meaningful changes. And if you don't make those meaningful changes, this cycle won't end. It will just continue and continue and continue, leading to problems. So very, very important. Again, number one thing I could teach you. Now, on that note, let's pull this up. I said that, you know, one of the traps that you get stuck in is drug-induced nutritional deficiencies. And this is a common problem, a super common problem. This is why I have a chart for you here, because it's so common that, you know, I wanted to create a chart for you that had some of the most common drugs prescribed and what nutrients they actually depleted. And if you'd like to get access to these charts and diagrams, you can do that. You just have to make sure you subscribe. Go over to glutenfreesociety.org, sign up for our newsletter, largest newsletter in the world for people trying to navigate the gluten-free diet. But this diagram, and this is not by any means, by the way, a comprehensive diagram that lists all medications. There are textbooks that are written on this topic. Unfortunately, those textbooks are not used in medical school to teach medical doctors the nutritional consequences of writing prescriptions. And that's unfortunate. And there's not a whole lot that you can do about it. You could certainly, you know, print this out and take it to your doctor. You could also just try to have a meaningful conversation with that doctor about the potential for drug-induced nutritional deficiencies. But again, most of them don't train in it, so they don't understand it. They don't know it. They're going to look at you like you're crazy. But this is a very, very real phenomena, a very, very validated phenomena to the level, again, that there are multiple medical textbooks written on the topic. I actually used to lecture nationally to doctors all over the country in the U.S. on this very topic. I have a pretty in-depth, probably one of the most in-depth and researched presentations on this topic. But that aside, common medicines here, you can see blood pressure medicines, cholesterol medicines, diabetic, or pain or anti-inflammatory medicines, heartburn or heart reflux, acid reflux, and then hormone replacement, some of the more common categories. Again, what this chart doesn't include that's pretty common that you should investigate if you ever have to take an antibiotic or antibiotics, because they can cause B vitamin deficiencies. Antibiotics can damage the gut and contribute to the development of yeast overgrowth and a number of other problems. But if you look here, different classes of medications have different effects on different nutrients. And so a lot of these nutrients are the same nutrients I showed you from the research that we know gluten can cause. So gluten can cause, what were those? They were B12 and folate and copper and vitamin D and calcium as some of the more common ones, right? And omega-3. And you look here, the B vitamins, vitamin C, magnesium, calcium. You'll see CoQ10 on a lot of these. CoQ10 is the rate limiting step for energy production in your cells. And so this is one that massively can cause fatigue. It can, you know, deficiency can elevate your blood pressure. Deficiency can cause congestive heart failure, can cause neurological damage. We see iron on this list. Iron, very, very common. Deficiency caused not just by gluten. Iron deficiency also under heartburn medications. We see women, those of you who are taking drugs like hormone replacement, estrogen-based therapies, look at all the B vitamin depletions caused by estrogen. Okay, then we got magnesium, zinc, and selenium that can also be depleted by these hormones. So again, very important. I'm not going to belabor this chart and read it to you, but I think it's important that you maybe take a screenshot of this and add it to your library of references for future review. Should you ever have to go on a medicine, or should you ever decide to go on one of these medicines, at the very least, you want to know what deficiency could be caused by these different medicines, and you want to potentially aim to supplement so that you don't end up in trouble. I mean, probably the most common one that most people know about are the statins, right? The statins that are very well established and very well known to cause CoQ10 deficiency. The irony here is that statins are used to treat the risk for heart disease, and when you lower CoQ10, you increase the risk for heart disease. So you're treating your heart disease risk in one way and inducing heart disease risk in another, which in my opinion never made sense to trade one risk factor for the same risk factor in another way. But that's the nature of that beast. So you just need to be aware of it. And so again, if you're taking any kind of medication, you need to have that conversation with your doctor about drug-induced nutritional deficiencies and what you can do to overcome it. Now, this is my opinion. This is 4 supplements that everyone with gluten sensitivity should take, kind of bar none. If you're not working with any kind of doctor at all, if you're just saying, okay, what can I use or what can I take to cover as many bases as possible without any kind of testing? Again, this is just general based on my experience. And the first is a high quality multivitamin, multi-mineral. So a multivitamin, multi-mineral is number 1. And the reason why is a multivitamin, multi-mineral will cover your basic fundamental bases, meaning it's going to cover all of your vitamins, your fat-soluble vitamins, your vitamin C, your B vitamins. It's going to cover many of your primary minerals that are commonly deficient. So it's going to give you kind of a basis or a baseline for this. Again, it's not going to be high enough in certain things if you have major deficiencies, which is why it's so important to get tested, but it is going to give you think of it as food insurance, okay? Number 2 on the list is an omega-3, and I mentioned that this is probably the 5th most common deficiency I see in people with gluten sensitivity. It's very, very common. And one of the reasons why with gluten sensitivity, one of the primary side effects is fat malabsorption. As a matter of fact, fat malabsorption is one of the tests that many GI doctors will run to help them understand whether or not they need to go further and look for celiac disease. So a lot of doctors actually look for markers of fat malabsorption. And so what we see with fat malabsorption is, remember, omega-3 is fat. So is vitamin D, vitamin A, vitamin E, vitamin K, they're all fats, right? And so fat malabsorption leads to fat deficiency. These are fats, so you're going to malabsorb your omegas as well. But this is a very, very common one. And if we're talking about quantity of an omega-3, because they come in all different shapes, sizes, flavors, etc., you're looking at, in my opinion, the average adult 2 grams a day, and that should be an almost even split between 2 types of fat. There's usually with these, there's EPA, and then there's another compound called DHA. These are the active omega-3 fats, and so it should be close to an equal split. It may not be exactly an equal split, but it should be close to an equal split. So approximately a gram of DHA and a gram of EPA a day to get those levels to a place where they're helping support you. Another is probiotics, and here's one of the reasons why the probiotic is something that I recommend. There's a lot of research coming out now. A lot of research. As a matter of fact, I'm getting ready to present on this, on antibiotics. One of the most commonly prescribed drugs in the world today, antibiotics. Okay, now antibiotics have side effects, and one of them has to do with increasing the risk of celiac disease, of actually developing celiac disease. A number of studies have now shown that this is something that we believe pretty strongly, that the earlier you have antibiotic usage in your life, the greater at risk you are for developing celiac disease. In essence, for the gluten to damage your gut to a level that inflames it and destroys the villi, leading to malnutrition. Okay, but something else that antibiotics do is a very common side effect is they cause a yeast overgrowth. Very, very common. Now, yeast overgrowth is a very, very common situation for somebody who's gluten sensitive and just starting the diet. A lot of people have this yeast overgrowth. And in part, a lot of people have this because they've had a history of antibiotic use that were part of the trigger for their gluten issue. But some people have it because they overconsume carbohydrates, and we all have healthy yeast, a healthy amount of yeast in our guts, but when we overfeed them, we increase their numbers, creating an overgrowth. Now, there's science that shows that yeast, so if we look at yeast as a microorganism, they produce something called an HWP. That stands for hyphal wall protein. HWP is a type of protein. Yeast commonly produce it, and this protein cross-reacts with gluten, so it mimics gluten. And so what happens is sometimes a person goes gluten-free, but if they also have a yeast overgrowth, they have this excess quantity of hyphal wall proteins being produced by the yeast. This protein mimics gluten, so their body is behaving like it's still getting exposure to gluten, which is causing gut damage and GI damage, which is leading to malnutrition. So this is one of the reasons why probiotics is on the list. I went through that long and drawn-out explanation to come back to why I recommend probiotics. Probiotics, first of all, my philosophy is first do no harm. So like if you're going to do any kind of supplementation at all, we want to first do things that we know won't hurt you. And all these things are super safe. There's no contraindication really for any of these things for anyone. The only contraindication of any of these is omega-3. If you're getting ready to go have a surgery, most of your doctors will want you to discontinue an omega-3 because it can keep the blood thin. And when they're doing surgery, they don't want your blood to be too thin so that you bleed too much during the procedure. But that's really the only contraindication for taking omega-3, at that level. So again, very, very safe, won't do any harm. But if you have that history of antibiotic use or you have that yeast overgrowth, what probiotics do is they actually create competition for the yeast. So remember, your gut's like a garden. You've got weeds and you've got crops. You want your crops to grow and yield good, healthy things for your body to utilize, right? So think of your antibiotics as not your antibiotics, but think of your probiotics as your healthy crop that's going to bring fruits and vegetables and other things to you. And think of yeast as the weeds that are snuffing out those things. Okay, so this will create competition. So if you do have a yeast overgrowth, at the very least, it's going to create competition and help maybe potentially control that. Okay, but number two, these probiotics, what a lot of people don't realize, especially lactobacillus and bifidobacter, these are two of the main ones that have been studied. We're now learning that these probiotic deficiencies, low levels of these strains of probiotics, actually also increase the risk for developing a gluten reaction or gluten sensitivity. So if you come back to what we said, antibiotics increase the risk for celiac disease. One of the reasons why is they can cause a yeast overgrowth, but another reason why is they knock out your good bacteria, which has also been linked to the development of a gluten issue. So probiotics, very important. Then we have digestive enzymes. And one of the reasons I recommend digestive enzymes is because as I've already laid out to you, most people with a gluten sensitivity, when they learn about it, or if they have celiac disease and get a diagnosis, their gut's damaged. And what's damaged? The villi. Where do many of the digestive enzymes come from? They're produced by the cells of the GI tract. So if your gut's damaged, your gut's producing less digestive enzyme, that means that when you eat your food, you're going to break it down less efficiently. And remember, why do we need to break our food down? What are we trying to get at? We're trying to get at the vitamins, the minerals, the omega-3 fats, and the other healthy nutrients from the food. And if we lack digestive enzymes because years of gluten damage has destroyed, and damaged the gut, then how are we going to get the nutrition from the food we eat? Again, we've taken the gluten out, but does the gut fully repair if the nourishment coming into the gut isn't capable of being broken down and digested? So a digestive enzyme is a very good place to start. With digestive enzymes, what you really want to look for is you want to look for something that's somewhat full spectrum, like it has multiple types of enzymes in it to break down fat, carb, as well as protein. So something that can help break down all three of what we call the macronutrients to support that breakdown. So again, this is if you do no testing, right? A high quality multi and omega-3 probiotics and a digestive enzyme, because probiotics and a digestive enzyme can help you improve your gut health, okay, which will help your gut get more from the food that you eat. And in the long run, we want you to get more food or more nutrients from the food that you eat. Why? Because ultimately, you shouldn't have to rely on fistfuls of pills to maintain your health. You should really have a good functioning gut that can process food well, and it can extrapolate the vitamins, minerals, and other nutrients from food so that you're well nourished. But this is a really good place to start. And if you've never had any testing done, this is a really good place to stay until you get your doctor to run some tests. So let's talk next about the tests. Which kinds of tests should we look at running? Let's make a little room here. So you see the bottom of this. I've listed some of the most important tests that you can have done that are going to help you understand and assess your nutritional status. And one of them, you see this top one here, says lymphocyte proliferation, okay, to measure your vitamins and minerals. This is the most accurate way to assess long-term nutrition. Long-term. Why? What's the problem with serum? So a lot of doctors will use serum testing, and why is serum testing not a great idea? Serum testing is a reflection, in most cases, of your last meal. So for example, let's say you had a steak for dinner last night, you go in tomorrow to see your doctor, they run your vitamin B12 levels, your B12 levels look normal because you just ate a bunch of B12 and it's hitting your bloodstream today. It's your last meal. It doesn't reflect long-term, and when it comes to nutrition, it's kind of like blood sugar. Those of you who've ever gone to the doctor, maybe you've got a blood sugar issue and they measure your blood sugar, they don't look and they don't measure your glucose and call you a diabetic if it's high. They measure your glucose, and if it's high, they'll monitor it several times to see if it's high consistently over time. But what they'll really do is they'll run this test called a hemoglobin A1C. And why do they rely on this test instead of this serum test? Because a hemoglobin A1C is a 3 to 4 month average of your blood sugar, whereas glucose represents your last meal. And even though they're having you take it when you're fasted, it's still a representation of your last meal or last stress point. Remember, a lot of people go to the doctor, they're stressed out because they're in the doctor's office. Stress causes the disruption of blood sugar through catecholamines and other neurotransmitters and hormones like cortisol. So when your cortisol levels go up because you're stressed, because you're in the doctor's office, your glucose goes up even if you haven't eaten. And that, for a lot of people, gives a false reading. So we don't like serum tests because they can be manipulated by stress and other hormone or variable factors. This is why we like these long-term tests. This lymphocyte proliferation for nutrition gives us an average of 6 months. And the reason why we know it gives us an average of 6 months is because this cell type, it's called a lymphocyte. It's a white blood cell, and it lives and dies in about a 6-month span. So it has an average life cycle of 6 months. So we know when we can measure internally inside that cell, we're getting a long-term storage of where your nutrition is. So it's more of a reflection of the long-term status and less of a reflection of your last meal, which can be deceiving and misleading. So we like this. This is a really good way to measure. Now, some doctors will look at you like you've got, horns coming out of your head if you say, I want to run a lymphocyte proliferation test. If they're doing that, first of all, find you a doctor who's an expert in nutrition and let somebody who's an expert run the test for you. Because again, here's the thing, you wouldn't go, if you had cancer, you would go to an oncologist, you wouldn't go to an OB-GYN necessarily, right? You go to the doctor that's got the most expertise in that area that you're looking to get evaluated, and I wouldn't look at it any differently with nutrition. Most doctors, in the whole world, how many doctors are actually board certified in clinical nutrition? There's less than 500 in the entire world. It's not a high appeal career field for many doctors to go into, and the others they're looked at with a higher level of esteem, which in my opinion is the wrong way to look at it, because nutrition should be held at the highest level of esteem. But there aren't many board certified clinical nutrition based doctors to choose from. But you should look for one. You should try to find, and at the very least, if you can't find a doctor with DACBN behind their name, because that's what that stands for, Diplomate with the American Clinical Board of Nutrition, you should look for a doctor who's gone on after medical school or after, whether it's a naturopathic doctor, a chiropractor, whether it's an osteopathic doctor, somebody who's gone on to do advanced training and education in nutrition to a great degree, right? Somebody who's got an expertise in it, because if you allow somebody without an expertise to run a bunch of tests on you, then where you'll run into a problem is interpretation. They'll look at it and they won't know what to tell you. They won't know how much B12 is enough to correct a deficiency, or how much vitamin D is enough to get your level up, right? They won't have those kinds of answers, and then you'll just be left on your own with a bunch of lab tests trying to interpret them. And again, that's a bad place to be in. So you want to look for somebody, if you're going to run these tests, look for somebody who's an expert in running these tests so you can get a solid answer. Now, so lymphocyte proliferation helps you measure vitamins and minerals for that long-term 6 months. Now, some doctors will use what's called RBC testing. RBC stands for red blood cells. So just like you can look at blood sugar averages in red blood cells, that's what a hemoglobin A1C test is, you can look at nutrients in red blood cells as well. And in some ways, this is definitely more accurate than serum, but nothing's more accurate than lymphocyte proliferation. Okay, so again, I'm just trying to give you another option. Now, an iron panel with ferritin should always be measured. You'll see down here where it says complete blood count. This is the test that measures your red blood cells, your white blood cells. It measures the size and the shape and the color of your red blood cells. It measures your hemoglobin and your hematocrit, things to help you understand whether you have anemia. Remember what I said earlier, is a lot of people have iron deficiency but don't have anemia. This test helps you understand whether you have anemia. This test helps understand whether or not you have a problem with iron. So an iron panel with ferritin. Remember, iron is circulating iron, and this ferritin is stored iron. It's iron that's stored in your liver by your liver, okay? So important to ask for that test as well if you're trying to assess your iron. Remember, iron, one of the top 5 deficiencies for those with gluten sensitivity, so it's important to analyze whether or not iron is an issue. 25-OHD, this is a vitamin D test, okay? And it's probably and arguably the most well-studied and most researched method to accurately assess vitamin D levels in an individual. And so this is a simple blood test. Most doctors know how to order it, but again, in this one, I'll even give you a little range here. So most labs will say between 20 and 100 is normal. I would say if you're gluten sensitive and you're looking to recover, you want to get your level between 70 and 100. Like, you want to keep it up at that level while you're trying to recover and heal and repair. Another test, I mentioned this earlier, homocysteine. I showed you a diagram earlier that said with elevations in homocysteine, it's very common in people with gluten issues because of B vitamin deficiencies. And homocysteine is a marker, an indirect marker that tells us a little bit about B vitamins. And so it's, again, indirect, meaning not direct, but it can tell you a little bit about B12, about folate, and about B6, and about B2, because these nutrients actually help keep homocysteine in a normal range. And so if you're low in these nutrients, it's oftentimes an indicator that you could be deficient in some of these B vitamins. And then another test is plasma amino acid testing. So this is really common. As I mentioned on that first slide, and in this study that came out of Mayo, is that protein, serum protein, was found to be low in almost 20% of individuals with confirmed celiac diagnosis. And so they're not eating enough protein or they're not absorbing it adequately. But plasma amino acids, so understand that amino acids are the building blocks to protein, okay? And there are, arguably 10 essential amino acids, meaning of the 22 or so different amino acids, 10 of them are essential, meaning you have to eat them so that you can make all of the other amino acids. And so this can actually be measured, whether or not you're low in specific amino acids. An example of an amino acid many of you have probably heard of is L-glutamine. L-glutamine is not an essential amino acid, but under certain conditions becomes essential because, for example, if you just had surgery, you need more L-glutamine for healing and repair. As a matter of fact, I had somebody last week, she was going in for a surgery. We put her on L-glutamine because her wound kept swelling and retaining water. And when we put her on L-glutamine, within a day, the water retention went away completely and the swelling went away. that's an example of how an amino acid can become essential under certain conditions. And so post-surgically is one of those conditions, but so is post-gluten trauma. So post-gluten-induced inflammatory damage can lead to a greater need for certain proteins or certain substrates of proteins or amino acids. And so this can be measured to give you an accurate assessment of what you might be low in. Another one is high-sensitivity C-reactive protein. This test here, HSCRP, it's measuring inflammation, okay? And so sometimes what you can do, if this is elevated, this is not a direct marker saying, hey, you're deficient in a particular nutrient, although it can be. For example, sometimes HSCRP is elevated in people that don't have adequate vitamin C or people that don't have adequate omega-3 fatty acids. So it can somewhat be an indirect marker. It's a marker of inflammation, but it can be an indirect marker of nutritional status in some ways. And that's, again, just one other aspect of how your doctor can help you understand more about your nutrition. And then down here, again, complete blood count. There are other elements on a complete blood count that can help us to understand B vitamins. So, you know, how many white blood cells or red blood cells or platelets that you're producing. If your levels are low, that might indicate a B12 or a folate deficiency or B6 deficiency. Those B vitamins are necessary to stimulate bone marrow to produce blood cell elements. And so when you're measuring this, if they come back low, I've seen it where a lot of doctors will say, oh, it's just normal. They don't know what to tell you when it's low, so they just tell you it's normal to get you out of their office. Again, I'm putting words in a lot of doctors' mouths, and maybe I shouldn't be doing that, but it's a common scenario I see. People tell me that on a regular basis. But this, again, can help us understand some elements about nutrition, as can a basic metabolic panel. There are certain aspects of a basic metabolic panel that also can tell us about minerals and mineral deficiency. For example, alkaline phosphatase, which is a marker for bone damage and liver damage, but low alk phos can sometimes be an indicator that zinc levels are too low. So that, again, that's just an example. We're not going to go into an entire blood test interpretation on nutrition tonight, but I wanted to give you some core fundamental lab tests that if you asked your doctor for would help in the proper assessment of your nutritional status overall, so that if you needed to target supplement or change your diet to incorporate more of certain nutrients, you could dig yourself out of that trap, right? Again, that trap that never ends, that damaging trap that most people are stuck in if they don't understand nutrition or if their doctors don't understand nutrition. So to reiterate, this is the number one most important thing I could teach you. And if you do anything after walking away from tonight's show, it's to understand this. If you're gluten sensitive, if you have a diagnosis of celiac disease and you're not having your nutritional status measured twice a year, is what I recommend, then take that home as the message. Get with your doctor, ask them twice a year to help you assess this. Remember what I told you? Lymphocyte proliferation gives you an average of the last 6 months. Okay, so if you have that type of testing done around the 6-month mark, that's twice a year, and that allows you to make adjustments and changes to your diet and to your nutritional supplementation, because the ultimate prevention is not taking drugs to reduce risk factors. The ultimate prevention is giving your body what it needs before your body breaks down because it lacks something to such a great degree it can no longer function and heal you, right? So that's number one, top priority, is assess your nutrition to assess your overall health and prevention. All right, let's open it up for any questions that you guys have tonight. So, let's see here. So, Juan's asking, if you improve the status of stomach acid levels, are you less likely to have symptoms when accidentally glutened? No. But if you improve the level of your stomach acid production, you are more likely to better break down your food so that you can digest and extrapolate nutrients from that food. But having more stomach acid is not going to protect you from gluten if you're getting glutened. What vitamin deficiency can cause painful bladder syndrome? Like interstitial cystitis, already on a true gluten-free diet for years. So Interestingly enough, it's not necessarily, at least in my experience, it's not a vitamin deficiency that I see play out with interstitial cystitis, although B vitamin deficiencies are very common amongst people with the diagnosis of IC. It's more about oxalate in my experience. If you're following a true gluten-free diet, one of the things about the true gluten-free diet, depending on how you're eating, if you're gravitating toward a lot of the gluten-free flours, for example, the almond flour, it's very high in oxalate, and oxalates are known trigger factors for interstitial cystitis. So you might just go back and review. I did a very lengthy video on oxalate and a blog post on oxalate with a lot of research that you can track down and look at that. And I would look at maybe incorporating lower oxalates in your diet to see if that doesn't help you. The other thing you can ask your doctor to run is a 24-hour oxalate urine test to measure whether or not you have excessive oxalates that might be contributing to that problem. Let's see, Robert asks, why is B6 often overlooked and not talked about? Mostly because it's not talked about because there's a lack of knowledge. I mean, what doctor wants to showcase their ignorance? I mean, ultimately, that's the way I look at it. B6 is super critical for a number of different functions, but it's not as popular as, say, B12. B12, probably of all the B vitamins, B12 and folate have been made wildly popular by genetic tests available online that measure MTHFR and MTR gene mutations that are linked to folate and B12 function. So I would say with B6, though, there is a genetic test linked to B6, potential B6 problems and mutations, and that's cystathione beta synthase, or the CBS gene, but not very many people talk about it. I think my friend and colleague Ben Lynch is probably one of the few that really go into the depth and the details around that. Let's see here. Can lack of enzymes cause slow gut emptying? Tracy is asking. Yes, lack of enzymes can cause slow gut emptying, and double down on that. Not only can they cause slow gut emptying, but they can cause your food to rot inside of you and releasing all kinds of putrefaction byproducts that can damage your GI tract, creating leaky gut. So lack of digestive enzymes is not a good situation to have. This is one of the reasons why pancreatic disease is so dangerous, pancreatitis and pancreatic dysfunction, because remember, your pancreas is one of the primary producers of enzymes to help you digest your food. Let's see here. Can you explain digestive enzyme elastase from the pancreas and its difference from the enzymes that you mentioned? Yeah, so there are a number of different types of enzymes, but ones that doctors will traditionally measure, elastase is one, and it's an enzyme produced by the pancreas that helps you break down your food. But then there's, in the bloodstream, there are some enzymes that many doctors will look at and measure. Amylase is one of them, lipase is another. Now, if these are pancreatic enzymes, if they're extremely high in your blood, then it's an indicator that the pancreas could potentially be inflamed. So there are indicators for pancreatitis. Now, if the enzymes are extremely low, this can be an indicator that your pancreas, that the exocrine function of your pancreas is underperforming, and that might make you predisposed to not being able to properly digest your food very well. Either scenario is not good. But amylase, as a general rule of thumb, amylase is an enzyme that helps you break down carbohydrate. Lipase is an enzyme that helps you break down fat. So different enzymes are more specific for different macronutrients. And so those are some of the basic general differences. Let's see. Okay, I think I answered that one. Yeah, cereals, somebody's commenting, cereals use mostly iron filings, which are indigestible. Yeah, the iron fortification of the cereal industry and the grain industry is horrific. It's not a healthy version or variety of iron that I would encourage. And that's the way with a lot of the fortification. Folic acid is the B vitamin. It's a synthetic B9 that's used to fortify cereals and breads and other things. And in my opinion, folic acid increases the risk, and not just my opinion, but researchers have actually studied this, can actually increase the risk for certain types of cancers and other health issues. So a lot of times when the U.S. has a fortification law, for nutrients in a food, it doesn't always pan out the way they had hoped it would. Yeah, I don't know that the drug companies fear me. I got to look over my shoulder, I'll say that. But glad you're enjoying honesty in my message. I appreciate that, Prince. Does spirulina contain gluten or histamine? I'm not sure on the histamine content of spirulina. That being said, does it contain gluten? No, it does not, unless it's cross-contaminated with gluten. But true spirulina does not contain gluten. Let's see, Chucho asks if I do vitamin and mineral testing. Of course I do. I've been doing it for 20 years. It's something that, when people come to see me, that we do as a basic, to me, it's the most basic of basic parameters you can investigate if you're trying to help somebody in their path. Let's see, scroll down on that right side and on that left side for me. Let's see here. 2 questions from Laura. When I had a gluten flare, I took lysine to help reduce my EBV load. To my surprise, it caused my psoriasis to flare. Yeah, that doesn't surprise me. So first of all, we don't have time to get into a dissertation on Epstein-Barr virus or EBV, but when you take high doses of an amino acid, there can be consequences. Certain amino acids compete with others. So high doses of lysine, for example, can affect your arginine. And your arginine is very, very important amino acid for vasodilation, for blood vessel health, for cardiovascular health, but also for immune function. And just like lysine is important, it's an amino acid commonly used because it's been shown in cases of herpes virus to reduce the replication. I don't know that I've seen any great solid research that backs up that lysine can be used for every single type of virus, but it's just one that commonly that people equate for using in viral cases. What test do you recommend for fatty liver? If you're talking about what test to identify fatty liver, I recommend that you go visit your doctor. They're probably going to run an ultrasound. They might do a CT, an abdominal CT scan. They're going to run some blood tests that are going to look at different types of liver enzymes. And the imaging might tell them that there's fatty infiltration, but the enzymes might tell them that your liver is struggling to properly function. So those are tests to help you identify whether or not a fatty liver is a problem. As far as intracellular tests, that's what you ask for. You ask for an intracellular lymphocyte proliferation test. Okay, so part 2 of that question from Laura, can lysine be an instigator of gluten sensitivity? Not to my knowledge. It's not that it's an instigator of gluten sensitivity, but I would look at the quality of the supplements that you're taking, because many over-the-counter products are contaminated and cross-contaminated with gluten. It's because a lot of supplement manufacturers produce, heavy quantities of wheat and other grains in their factories, and so you can potentially get that cross-contamination. Matt is asking, what foods do I recommend for someone with celiac disease? It's not that I recommend any specific foods, Matt. I recommend that you eat healthy. I recommend more not what to eat as much as I recommend what. Let me reframe that. I recommend more not what you should eat, but more what you shouldn't eat. So if you've got celiac disease and you're not following a true gluten-free diet, some research says as many as 92% of people following a traditional gluten-free diet fail to have recovery of intestinal damage after years of gluten-induced problems. So a true gluten-free diet is what I would recommend as far as what foods to eat within that true gluten-free diet. Probably the easiest and quickest way to get access to something like that would be to read No Grain, No Pain and apply phase 1 and phase 2 of that diet immediately. And then from there, just going on and observing what foods that your body agrees with more than anything else. And if you continue to struggle, get with a doctor to run some testing to help you analyze if there are potential foods that are healthy otherwise that you're actually reacting to as a unique individual. I love that. Judy says, thanks for all your info. Your book changed my health and my life. I can't hear that enough, Judy. That's really what fuels me. So thanks for sharing that. Do you have supplements with them all in together? Carol, I'm not sure if I understand what you mean, but do I have supplements with all these nutrients together? Yes. If you are looking for, again, a good quality multi, as I was talking about earlier, I moved the slide, but we've got two different types of multivitamins. We have one that's called Ultra Nutrients, and then we have another one that's called multi-nutrients. And the difference between the two is that multi-nutrients is a higher B complex in it. So it's designed for people that are lower in B vitamins, aggressively so. And so it just has a higher quantity of the B vitamins in it, particularly vitamin B6, which is very, very critical for people to repair and recover post-gluten-induced damage. So to answer your question, yes. If you go over to glutenfreesociety.org and hit the shop button, you'll find an entire library of specialty formulated products that I've created over the years. As I've seen different people, these are products that I've created based on my expertise in the field of nutrition. And you can peruse through there, but we've got pretty much everything under the sun. Rachel is asking about methotrexate. Is it dangerous? Yes. But if it was diagnosed, I would imagine you probably have rheumatoid arthritis or rheumatological arthritis. Methotrexate is a cancer medicine. It's actually used, it's an anti-cancer drug. And one of the dangerous aspects of methotrexate, side effect-wise, is it inhibits folate. This is why if you were prescribed it, your doctor probably gave you prescription folic acid. Again, the problem with folic acid is that it's a synthetic version of folate. And so, again, drug-induced nutritional deficiencies, methotrexate induces folate deficiency. Methotrexate inhibits your DNA and RNA from replicating. And the problem with that is it causes your body over time to not be able to heal and repair things. And so fast forward that use by 10 or 15 or 20 years. Another side effect of methotrexate that, it's unfavorable is that it damages the GI tract. There's a lot of research showing that methotrexate contributes to leaky gut. And so those will all be concerns I would have. I'll bring those concerns up with your doctor, and walk through those. But yes, there are aspects to methotrexate. Remember, it's like any other medicine. There's a reason why doctors describe it as something called a risk-benefit ratio. Does the risk of the side effects of the drug outweigh the benefits the medication provides to the patient? And so this is what doctors are thinking about in their mind before they prescribe it. The problem with traditional medicine, and the way I see it, is that most doctors don't understand drug-induced nutritional deficiencies, and they underscore the long-term detriment of using a medicine over years and years and years. And some doctors, they've seen crippling, in the case of methotrexate, some doctors, they've seen crippling, rheumatoid arthritis, and they think, okay, well, we don't want you to become crippled, so the risk of the side effects of that medicine is better weighed against you potentially becoming crippled. I personally don't think that way. I think that, more than trying to drug you into submission of your symptoms, I think a better question to ask would be, why does the disease exist in the first place? What are the trigger factors for you and how that disease began and how that disease process began? And are any of those trigger factors diet or lifestyle issues that if you changed would reduce the severity of your illness? That really is where the true empowerment starts. It's in identifying what you're doing wrong and making adjustments to diet and lifestyle. Can you have gluten sensitivity if you have no GI symptoms? Jane wants to know. Jane, that's a great question. Yes, that's why we have this term called non-celiac gluten sensitivity. There's another term in the medical literature oftentimes referred to as silent celiac disease, meaning a person can actually have a gluten issue, but they don't have any observable damage to their GI tract when their doctor measures or does a scope, but they have gluten-induced damage in other parts of their body. Silent celiac disease can manifest, for example, as gluten-induced ataxia and neuropathy. It can manifest as fatty liver disease. It can manifest as hypothyroidism. And those are all areas of where the damage is occurring outside of the GI tract. What doctors oftentimes refer to as extra-intestinal manifestations. Okay. Donna's asking, what's the best thing for yeast overgrowth? Depends. I would say there are a lot of different strategies for yeast overgrowth, but the number one thing that you should do if you suspect a yeast overgrowth is stop heavy carbohydrate consumption. Yeast is like a stray cat. If you put food out on the porch, it keeps coming back. And the food on the porch analogy is kind of like the overconsumption of carbohydrates. You feed the yeast with carbohydrates. They love fermenting carbohydrates. So lower carbohydrate diets, this is why keto diets and carnivore diets and paleo diets are super popular, because they're lower carbohydrate, generally speaking, and oftentimes that lower carbohydrate can help starve out a yeast overgrowth. Alcohol is a big no-no. Sugar is a big no-no. So if you're not changing your diet to address the potential for yeast overgrowth, it doesn't matter what pills you take. The pills come after diet change. When you've changed your diet, if you're looking at what are some things that have natural antifungal properties that you might be able to use that could support, your overall health in that way, you can use there lots of different things. I mean, I have a formula called Yeast Shield. I have another formula with caprylic acid in it. Caprylic acid is a very good and very well established compound that yeast don't like. That it makes yeast struggle to grow and replicate. It actually carves little holes inside the membranes and cell walls of yeast, so it can be a very effective. And another is a good probiotic. Again, create competition. There's really 4 strategies to help with yeast overgrowth. 1 is to flush them out. 2 is to starve them out. 3 is to poison them out. And 4 is to create competition for them. And that competition is created through probiotic use. So hopefully those strategies are helpful for you. Oh, good. I like this question. We don't get many of these. Last days, 316. What's the best way to keep or get weight up for a hard gainer on a grain-free diet? Probably the strategy that if you're on a grain-free diet and you're a hard gainer, you really got to get dialed in with things with your training like glutamine and branched chain amino acids. And really, what I prefer to see people use in this situation, so if you're trying to build your body and build your muscle mass, is a very, very potent amino acid formula with the individual amino acids in it. So not like your protein powders as much as your individual aminos in a formula that you can add to your protein powder. So that would be, I have something called Ultra Amino that's really, really good for that. Another thing is creatine monohydrate, probably one of the most well-studied and safest ways to pack on. And the way it works is it doesn't actually pack muscle on you, but it increases, when you're working out, you get to the burning stage where the muscle's on fire and you want to quit because it hurts so bad. What creatine monohydrate does is it gives you like an extra 3 to 7 seconds where you can put out 2 or 3 more repetitions of work. And that doesn't sound like much, but multiply that over 6 months for every workout that you do. And what it ends up doing is it ends up getting you better muscle tearing. When you get better muscle tearing, you get better muscle build back and regrowth. So tried and true creatine monohydrate, very, very good way to hydrates the muscle, but it can help you enhance your workout to pack on more for you. If that's what you meant, I think that's what you meant last days, but hopefully that's helpful. So Laura's saying, okay, so so 3 months ago I cut out rice, was already grain-free except for rice. Now I've been feeling so much weaker and have lost more weight and have less strength. If you cut out rice, what you may have done is cut out a source of calories and not replace that source of calories with something else comparable. And so what happens to a lot of people when they're going grain-free is they're struggling because they're trying to figure out what to eat at first. And so they end up undernourishing themselves. In essence, they're under the bar for total caloric value. They're not getting enough calories in to sustain normal, healthy energy production. So the first thing I would suggest that you do is count your calories and just see where you're falling. If you're, without your height and weight and age and everything else, which we don't have time to get into tonight, it's hard for me to give you kind of a number to shoot for. But I'll kind of give you a generalization. So a woman with a weight of about 135 pounds, if she's trying to maintain that weight of 135 pounds, again, depending on height and age and weight, is going to need somewhere in the neighborhood of 1,500 to 1,600 calories just to maintain that. And so just depending on where you're at, if you're at 1,200 calories, you're going to have a hard time keeping that weight on if that's your scenario. So count your calories first. Let's see here. Okay, so I'm gluten intolerant, but still eat it from time to time. Give me muscle pain? I'm not sure I understand your question in that. Look, if you're gluten sensitive and you're eating it from time to time, here's what you should know: that one breadcrumb of gluten, if you're gluten sensitive, can cause inflammation that lasts for up to 2 months. That's not a lot of gluten, and that's a lot of inflammation potential. So if you cheat once every couple of weeks, think about that. You're potentially perpetuating inflammation for 2 months, even though you're only eating it every 2 weeks. My advice is quit cheating, right? Dial it in, get it right. It's your life, and food is not more important than your health. Let's see. Heather asks, how can we get digestive enzymes for kids who have trouble swallowing pills? That's a great question. Heather, we have a product called Gluten Shield for kids, and it's a full spectrum digestive enzyme designed for kids. It's a chewable. And even for adults, we have many adults that have a hard time swallowing because of goiters or thyroid problems, and so chewable works better for them. So Gluten Shield for kids is a great product. It can be used in that regard. Let's see here. Let's scroll down on the left. Does too much protein cause gout? Question from Grace. No. Too much uric acid can exacerbate gout, and certain proteins can contain more, a byproduct of uric acid production than not. The traditional line of thought around gout is uric acid forms crystals in the joint, like in the toe, depending on where your gout is showing up. It's most common in the big toe, but it can also affect other joints in the earlobes and other tissues. Is uric acid. So, you might look at what you're eating that has high uric acid content. But one of the other things to consider, because I have seen actually the opposite be true. I've seen a number of people with gout who do better on a higher protein diet, despite what traditional knowledge would purvey or tell us. And so it's not always true that high protein increases a gout exacerbation. I see more specifically with gout, I see like high rich cheeses and things of that nature create problems with gout or exacerbations with gout. But one of the things I see that helps cut down on exacerbations of gout is zinc. Again, one of the reasons I recommend testing nutrition, there's an enzyme called xanthine oxidase, which helps to break down some of the byproducts that contribute to gout. And if you're zinc deficient, then you have trouble with that enzyme production, and it can become an issue. So you might consider, asking your doctor to measure your zinc levels as well if you're struggling. But I would less worry about protein intake and be more worried about quality, unless you've seen a direct reflective, like every time you eat, animal meat, for example, you get a gouty flare. In that case, you've got to listen to your body. You should have that intuitive to always listen to how your body speaks to you as well. So I think I answered that question. Marilyn also asked, what harm is done if I'm gluten-free but succumb to eating a plate of regular pasta from time to time? Yeah, there's a lot of harm done, especially if you're still struggling with Hashimoto's. That's the harm, right? Hashimoto's is known to be caused not just by gluten, but gluten can certainly be a cause of Hashimoto's. I have celiac and terrible problems swallowing. Any suggestions? Yes, Kathy. A lot of times what happens with celiacs is what we talked about tonight, is the nutritional deficiency caused by gluten for so many years creates an incapacity or inability to heal. And sometimes those nutritional deficiencies are mineral based. And so problem swallowing can come from different things. So one problem would be you have a goiter that's enlarged and it's putting pressure on your esophagus, making it harder to swallow. So definitely follow up with your doctor, have them palpate your thyroid, maybe do a thyroid ultrasound and rule that out, because celiac disease and Hashimoto's go hand in hand. A lot of times people have both of those diseases with the linkage to gluten. But another common problem that I see is somebody who's under a lot of stress and develops mineral deficiencies. A lot of the different minerals, for example, calcium, magnesium, and then you have electrolytes like potassium. When you're low in those, will cause spasm. If you've ever had a muscle twitch, like an eyelid twitch or shoulder muscle twitch, imagine your esophagus is also a muscle. And so if your esophagus is chronically tight, just like your muscles can get tight, well, your esophagus is a muscle, it can get tight. That means it can constrict up, it can narrow the opening, and it can make it harder to swallow. So again, going back to what we've talked about tonight, one of the probably best things that you could do is have your doctor run and look at your nutritional status, because if you've got calcium or magnesium or potassium deficiency or any of these nutrients that play a role in how your muscle contracts and relaxes, remember the smooth muscle of your GI tract contracts and relaxes. And if you've got virtual tightness of that tissue, it can create a trouble or a challenge for swallowing. But it'd definitely be a good idea to get it checked out. Jenny asked which one of our formulas has caprylic acid. It's called ultra caprylic acid, Jenny. So if you can't find it, you can always call the number on glutenfreesociety.org and they can send it out to you. Let's see, scroll down a little bit. There we go. If you have some celiac genes, hetero, but a grain-free diet drops TPO antibodies, should you assume you are celiac or non-celiac gluten sensitive? You can make that assumption. You may or may not be right. And here's what I mean. If you haven't read No Grain, No Pain, I'm just going to give you one example. Many of the people that go grain-free benefit for more than one reason. In essence, gluten is a protein found in all grain, but it's not the only protein in grain that's known to create or flare autoimmune problems. There's another, I'm going to give you an example in wheat. There's a protein called amylase trypsin inhibitor, ATI, if we want to just abbreviate that protein's name. ATI is known to activate toll-like receptors in the gut, leading to the potentiation of autoimmune disease. So you may have gone grain-free and you may not be gluten sensitive, but you may have just been reacting to the wheat protein ATI. So that's just one example of why it might not be gluten and that you can't 100% assume that you're gluten sensitive. This is one of the reasons why I like genetic testing. And I don't know what you mentioned, genetic testing. I don't know what test that you had done or how many different markers that you had looked at, but a lot of these online tests are inaccurate. I had a person today that had a 23andMe test done, and it showed that they didn't have any celiac gene markers, but they had not the same test, but they had a genetic testing done through Gluten-Free Society, and they actually had celiac markers. And this is, I can't vouch for what 23andMe does behind the scenes, but I can at Gluten-Free Society. We hold to a much higher standard because of our ethics and morals, and we're there to serve people. And again, that's not to say that 23andMe is not, but it just struck me as quite alarming to see a person that had a 23andMe test negative for celiac genes, but have a PCR test, which stands for polymerase chain reaction DNA test, that measures all the different genetic potential alleles for gluten sensitivity and non-celiac gluten sensitivity, and her results showed that she actually did have celiac genes. So again, I'm leery of a lot of these online testing services for that reason. It's not the first time I've seen that be the case. What besides collagen can help heal skin? Michelle asks. Lots of things, Michelle. Collagen is helpful, but copper and zinc are helpful for skin. Vitamin A is necessary for skin health. Vitamin E is necessary for skin health. Biotin is oftentimes referred to as the skin, hair, and nail vitamins. So these nutrients are all super critical and important for the skin to turn over properly and to make new skin cells in a healthy, robust fashion. So again, going back to why did I say tonight is the number one most important lesson I could teach? Because if you guys are getting the theme to a lot of these questions, when you ask me the questions, I'm alluding back to what I've already taught. The reason why it's the number one thing I could teach you is because if you know what your nutritional status is, you can largely stop guessing at which vitamin should I take to heal my skin, which vitamin should I take to grow better hair, which vitamin should I take to support my liver. You have to understand that vitamins and minerals have overlap in their function, right? If we just think of magnesium as the perfect example, to date, we know of more than 700 functions for magnesium alone. So it can affect your skin, it can affect your hair, it can affect your metabolism, it can affect your energy level, it can affect your sleep. There's so many different ways that one nutrient can affect you. So again, going back to the core of this message, which is if you analyze your nutritional status, you can take away a lot of the guesswork and you can get real accurate with your nutritional supplementation. Can gluten sensitivity cause the esophagus to contract out of sequence? Absolutely it can, Christy. I've actually seen cases. There's a condition associated with gluten, and it's oftentimes it's referred to as slow transit time by many doctors, or delayed gastric emptying. And one of the reasons why we get a delayed emptying is because the esophagus and the intestinal muscles, and they all spasm, right? So whether they're spasming in concert with one another or whether they're beating out of order, you can have that happen as a result of gluten exposure. Okay, let's see. I'm sure that why I got leaky gut. No, not a question. So that's a good question. Laura says, why can some people eat pasta and bread, etc., and others like myself cannot? I grew up with Italian parents and ate bread and pasta all the time as well as protein. I've ruined my stomach for 20, 30 years. That's the fundamental question, isn't it, Laura? Why can some people run fast? Why can some people, calculate math equations better, right? Why can some doctors understand biochemistry and nutrition better than others? I mean, we all have gifts. We all have talents. And we're blessed if we can discover what those talents are, and we're blessed if we can discover what those detriments could be. You're blessed to have discovered that gluten affects you. That's the way I would have you look at it, because just because other people can have it and it doesn't bother them the way it bothers you, doesn't mean that you should eat it or feel socially inclined to do so. And I think that's recognizing your gifts, your strengths, and your weaknesses is a part of the journey of life. So that's the best answer I could really give you in that scenario. Is muscle pain in the legs related to gluten sensitivity? Not cramps, pain. Yes, pain, inflammation. The book is named No Grain, No Pain. And muscle pain in the legs can definitely be a manifestation. There's a condition called myofasciitis, which is when your muscles and fascia become inflamed, and gluten can induce it, can create and contribute to it. So it's very possible that that's the case. Now, there's certainly other causes of muscle pain in the legs, but gluten can definitely be one of them. Okay, so this is a great question. So Jay wants to know, says, I'm on a wheat, rye, barley free diet. So you're on a traditional gluten-free diet. We'll crunch that into what's called traditional gluten-free. For 10 years, I eat organic certified gluten-free oat. My anti-gliadin antibody was high on a test. Does the Gluten Shield supplement get rid of the IgA reaction? No. You don't take Gluten Shield so that you can continue to eat gluten. The issue probably that you've got, Jay, is that you're getting gluten exposure and you just don't know from where. Now, oats have a form of gluten called avenin, and I don't care whether they're certified in organic or not. Avenin is a form of gluten, and for many celiac individuals, it creates a problem. Now, that being said, your test that you had done was an anti-gliadin antibody. There is no gliadin in oat, so the oat is not the cause of the gliadin elevation. You're getting wheat, barley, and rye from somewhere. And it's probably if you eat out at restaurants, or if you eat what we call here in Dr. Osborne's world, OPF. OPF is other people's food. You run the risk of gluten cross-contamination or potential. Now, your oats, even though they're certified gluten-free, might also still be cross-contaminated. There have been a number of times where products have been recalled because they were certified gluten-free, but actually ended up being cross-contaminated with wheat, barley, and rye anyway. And so that could also be an issue. So I would look at your diet and whether you're eating out or whether you're eating packaged foods or processed foods, because that's a lot of times where people are going to find that hidden gluten exposure, that traditional hidden gluten exposure. What's the best grocery store to shop for gluten-free foods? It's called your garden, honestly. There isn't a best grocery store. I mean, most grocery stores carry the same products from the same companies and vendors, so there's not like one that's better necessarily than the other. I would say it depends on what you buy. If you shop the perimeter of the store, which I would encourage you to do, you're in the meat section, you're in the produce section. And so there's very little risk of cross-contamination when you're buying, Creative strawberries versus when you're buying boxed packaged food that's produced in a facility that also practices the production of other grain-based foods. So, the grocery store, the perimeter, shop the perimeter and grow as much food as you probably can. Oh, okay, man, I think we ran out of time. Wow, we're really over tonight. I didn't mean to do that. Thanks for staying with me tonight. I know probably you stayed with me because we were answering all the questions, but hey, it's been great. I hope you learned a lot. And when I say the number one thing, I really, really, truly mean that. Nutrition is near and dear to my heart, but it's near and dear to your health, right? And if you understand what you lack and where you lack, then you're empowered to make meaningful changes that can have huge impact on your overall health and wellness. So really, really take what I said to heart. Take that list of tests, get your levels measured a couple times a year, and get it dialed in. This is Dr. Osborne wishing you an excellent, excellent week and excellent health as well. Take care. We'll see you next time.